Hey guys, today I want to talk to you about some Medicare increases that may start cutting into your Social Security at the turn of the year. You've probably heard by now that the Social Security COLA increase is going to be 2.8%, which is awesome. It's expected to bump people up about $50 a month on average. But what a lot of people don't realize is that Medicare changes are also going to kick in at the same time that could eat up that increase and possibly even more. So, today we're going to talk about what's happening and how you can protect your Social Security from those Medicare rate hikes. So, one thing you need to know is that Medicare is not a set it and forget it system. Every year there is a ton of change in this program. The government makes changes to the premiums and the deductibles and what they pay for and the payment rates and all of that. Your plans make changes, insurers make changes. There's just a lot of change in America's healthcare system. That means that even if your health conditions and your income are fairly consistent, your costs can still change dramatically. And every year we see these official updates that are published by the CMS. That's the Centers for Medicare and Medicaid Services. But a lot of people just don't pay attention to these. So I wanted to let you know what's on the horizon for 2026. So they've released the fact sheet. We know that Part A deductibles and premiums are climbing. We know that out of pocket costs for Part B are rising even faster. We're going to start by going over these numbers in quite a bit of detail, and then we're going to talk about what you can do to help protect your Social Security from being eaten up by those changes. So, first, let's talk about Part A. Part A typically covers inpatient hospital, skilled nursing facility, hospice, inpatient rehabilitation, and some home health care services. The good news here is that approximately 99% of Medicare beneficiaries do not have a Part A premium since they have at least 40 quarters of Medicare covered employment. However, if you are one of those 1% of people who owe that Part A premium, you should know that that amount is going up by 9.1% this year. If you're on the reduced premium, that increase is going to be $26 and your new rate will be $311 a month. If you pay the full premium, that's going to go up $47, and that new rate is $565 a month. And along with that, of course, the deductibles are changing as well. And you can see what they were, what they're going to be, the dollar increase, and the percentage changes in this chart here that you see on screen. And of course, this is going to apply to those inpatient hospital deductibles, the daily hospital coinsurance, skilled nursing facility coinsurance, and so on. In addition to that, we know those Part B premiums are also scheduled to increase. Part B covers physician services, outpatient hospital services, certain home health services, durable medical equipment, and other services that aren't always covered by Part A. Now, Part B costs are rising. We know that that standard Part B premium is going up 9.7%, which means it's going to raise to $202.90 instead of $185 like it was last year. The annual Part B deductible is also rising by just over 10% to $283. Now, we know that those with higher incomes will pay more for their Medicare premiums, and we did include this chart right here on screen, but we know that this doesn't apply to most of you, so we're just going to move on for now. Now, Part D is what covers your prescription drugs, including many generic and brand name medications and other things. Those Part D premiums do vary by plan. This is one of the reasons why we like working with Chapter, because they have tools that can help you see what your costs would be on various different plans. We also know that higher income beneficiaries have to pay an income related monthly adjustment, which you can see here on screen as well. But for now, if you're curious about what's happening with Part D, you're probably going to want to talk to your plan or with Chapter, because here's the thing. A lot of plans are changing this year, right? We know that rising premiums and deductibles are only part of that story because at the same time, a lot of Medicare Advantage and Part D insurers are cutting back their offerings and they're pulling out of areas and they're discontinuing services and they're cutting the amounts of certain benefits. And a lot of this is done really quietly, and you may not realize that it's affecting your plan until it's too late. Ultimately, though, these changes can mean fewer options, smaller networks, and in some cases, completely losing access to the plan that you liked. For example, we know that United Healthcare, Humana, and Aetna have been scaling back their Medicare Advantage and Medicare Part D offerings for 2026. Some of the changes that were reported by Kiplinger include that United Healthcare is cutting Medicare Advantage plans in 109 counties, which will cut coverage from 180,000 people. Humana is pulling out of 2 states and 4% of their covered counties. Aetna is pulling out of 1 state entirely and is pulling their Part D plans in over 100 counties. That's a lot of coverage that's going to be missed. Now, here's how you can figure out if you're affected by these changes. You should have received your annual notice of change, which is a letter that your plan is supposed to send you by September 30th of each year. Now, I know a lot of people don't even open these. They're overwhelming, they're confusing, sometimes they get lost in the mail. I get it. But that letter is very important because it's going to explain any changes in your coverage, your costs, or other modifications to your plan that would take effect in January. So if you have it, but you haven't opened it, please open it and take a look. If you don't know where it is, see if you can get another copy. Contact your plan, look at their website, see what your options are so that you can know what you're getting into in this coming year. Right now is your chance to make changes, right? Open enrollment is going to continue until December 7th. And this is the season where anyone can change their Medicare coverage for any reason. Now, if your plan was dropped or changed, this is your chance to find the best plan that still covers your doctors, your meds, and fits your budget. If your plan wasn't changed, it's still smart to review because other plans are changing and there might be a better one out there for you at this time. So the good news here is that you don't have to do this alone. Obviously, our sponsor chapter is amazing at helping people get the best out of their Medicare benefits. In fact, we've got a ton of good reviews from people who follow this channel and reached out to chapter and got great results. Anne said that she spent 2 hours on the phone talking to Brandon from chapter and he helped her get all of her meds and visits covered. He was amazing, followed up the next day with even more information, and ultimately Anne regained her over-the-counter benefits, better dental, better vision, and she's really excited about those changes. Christina, Brenda, and Melissa also had great experiences, as you can see here. But remember, you have to make this call by December 7th. So if you're interested, the number's over there, it's down there. I would encourage you to give them a call if you are on Medicare. I would also encourage you to go check out our recent video on freebies that many seniors miss because we found a lot of opportunities for you to save money and get some extra help. So go check that out, and I'll be back tomorrow with more ways that you can save money and get free stuff. I'll see you there.